conversation.
Okay.
There's something weird over here.
Just ignore that.
Yeah.
Okay. Yeah.
Yes.
You know, concierge medicine to me is really a way to try to bring practice back to where it used to be. Like when I started 20 years ago, it was more me, one patient, you know, one nurse to have more of a smaller, intimate setting, allow you to spend time with patients. And today's sort of corporate way medicine works really sort of doesn't allow that. You know, it detracts from the doctor-patient interaction.
And patients realize that, don't they?
Oh yes, they notice that, and the doctors notice it too. I think you know the way things are now, we both sides, the patient and the doctor, it's not an adversarial relationship, but some of the corporate things that are injected into what we do on a day-to-day basis does sort of put distance between the patient and the doctor, and concierge medicine is, I think, a way to sort of decrease that or get rid of some of that distance.
And patients that you have that are coming to you for that specifically now, what's their reaction? What do they?
We've been doing concierge about 4 months now. The reaction of the patients that participate in the program has been overwhelmingly positive. You know, they appreciate that they are not rushed, that, you know, I don't seem rushed when I'm in the room with the patients, and they get, it's not all about them getting everything they want, but they don't feel like getting their needs met is rushed, and I think that's the biggest part of it they appreciate. And having it sort of the time be more on their schedule as opposed to, you know, what a rushed practice schedule would be.
And as far as the benefits of the time,
Mm-hmm.
If you are a guardian patient,
Yes.
it doesn't matter. They'll cut that out anyway.
Yes.
But do I have weeks and months to wait, or how does that work? I mean, when I call into your office.
Well, you know, we block time for those patients. So, you know, part of my day will have no schedule, you know, no patients booked into that time except for guardian patients. You know, there may be some times where there's no one in that slot, you know, and that gives me time to, you know, answer emails or call the patients back on test results or call another physician directly about a patient and spend time doing that, which the traditional schedule really leaves no time for that. And then, you know, if a guardian patient would need to be seen, you know, we would book them for that time. We also book their physicals out or their follow-up visits for regular appointments, but they're booked a little differently where they've got a block of time, you know, 30 to 45 minutes that we'll spend with the patient if they need it. They may not need that much time. You know, they may want to come in and I'm in a hurry, but I want to appear at this time slot and then get out really quickly. Or they may come in with a whole list of problems that they want to go over and they've got the time to do that.
So this type of medicine, more personalized medicine, can come with different names, but you've chosen to go with the company called Guardian?
Correct.
And tell me about that.
You know, concierge medicine's been around for a while. You know, our practice brought it in because we saw it as something to help us cope with some of the changes that are happening with healthcare reform. We expect at a primary care level a whole lot more patients to need to see primary care doctors. And unfortunately, it's at a time when the dynamics of the market are there's already not enough primary care doctors. And we have a expanding shortage of primary care doctors over the next several years. And it's pushing a lot of primary care physicians to burnout. If you read most of the data on it, their burnout levels are reaching close to what emergency room doctors are, which are at the highest level already. So in an effort to allow doctors and patients in that setting, primary care, to help have a better experience, you know, I thought concierge would be appropriate for that. In my career after 20 years, you know, I also like to spend a lot of time with patients now to help them prevent problems or help them try to not have to take 20 different medicines. And in a more traditional practice where you don't have time, that takes time to sit down and work with patients on how diet, exercise, you know, removing medicines, nutritional supplements, you know, exercise recommendations. You can't do that in a traditional model. There's just not enough time. It's more geared toward what's wrong with you today, which pill can I give you, and I'll see you in 3 months. And I don't like it. I'm sure the patients don't like it. Most practitioners probably don't like it, but they really just don't know what to do about it.
So I love that idea that it's preventative as well as personal.
Right. Right. Well, I think those are the goals of it. You know, that many of the chronic problems that people deal with in healthcare today, you know, diabetes, high blood pressure, high cholesterol, heart attacks, strokes, you know, they are the problems that started 20 years before they came to a crisis. And if they would have had an intervention or some interaction with the healthcare provider that could have pointed in the right direction at an earlier time, maybe they wouldn't develop that problem. You know, and that's really, you know, what I'm shifting to in medicine is more dealing with a problem well in advance to try to prevent it or try to augment a person who's healthy and push them to a higher level of health.
And so the guardian, did we answer the guardian question?
I don't know. You have to,
Yeah.
if we do or not.
know.
Yeah.
Let's see.
Like I said,
So-
you get me talking, I
so-
might keep for a
no,
while.
that was
Yeah.
perfect. 'Cause I'm interested in that part of it. So the guardian issue, why did you go that direction?
Well, as a physician choosing to do that, doctors could, do it internally, develop a program, market it, to present it to the patients, manage all of the business aspect of it. Some people do it that way. You can go with some corporate entities that provide that service. There's some large national companies that do that. Guardian is a local company that does that. I wanted to try to maintain as much local flavor and also have as much direct input with the management and people in control of decisions how the program is run. So I guess maybe it's partly because I'm a doctor. I like to be in control of things, but I wanted to have it more on a local level, and I felt patients would appreciate that too. If they had any issues with how the program was run, they would have someone locally they could contact, and as opposed to calling someplace in New Jersey from an 800 number and leaving a message.
And it's all easy to work with. The concept is easy for your office to deal with?
Since it is relatively new, we've been in some development. We've actually been helping develop some of the ways we, process and manage those patients. So as far as ease, I'd say it has been easy, but it's like anything new. There's been a few bumps in the road we've had to work through, but most of them are logistic things. How do you get the patient from this area to another area, or how do we process this phone call, or who does that go to? More logistic issues have been any problems we've had with it.
What about one of the reasons why I always thought, oh, I can't possibly afford that.
Mm-hmm.
It's because it's a big chunk of money. But you all are working with like a tiered system, which makes it maybe more accessible to more patients.
Well, I think just the concierge concept in general probably did start off with people that might be more affluent. And early on, the certainly is not limited to that though. I think with things like the Royal Pains and television shows, that sort of present that model, that's maybe the impression people have of it. But I really present it as an augmentation of your traditional healthcare model, where you allows you to control time and give you more time with the patient, and the patient's more time with the physician. From a cost standpoint, a tiered structure does address some of those issues. Basically, if you just need time, you can go with one of the lower tiers. If you want more advanced, physical exam with studies that maybe your insurance wouldn't cover, you can choose a higher level. And one of the upper tiers do include some home visits for patients that may be homebound temporarily, or an example we use often is if you've got both knees replaced in a year and you might have to skip your 2 blood pressure visits that year. You could maybe choose that for a year or so and then go back to a lower level if you didn't need it.
And you're a pediatrician?
I'm internal medicine, did residencies in internal medicine and in pediatrics, and I'm currently in a fellowship for A4M, which is anti-aging and regenerative and functional medicine.
That's why I want to so do you see the whole family, or do you just see adults? Or
when I first started practice in Oldham County, I was the first full-time pediatrician in Oldham County. There had been some people that would come 2 days a week, 3 days a week, but I was the first one at a full-time pediatrics practice. So for the first 3 to 4 years of my practice, it was mostly children. But then when the parents realized that I was an internist, I saw the parents, and then you saw grandparents and aunts and uncles, But after practicing for 20 years, my practice has aged, like I have. So the patients now are probably some children, adolescents, but a lot of adults. And, the new kids I tend to see now will be some of the children of the kids I took care of when they were kids, and that's kind of neat. But my practice is predominantly, I would say, adolescent and adult practice now.
Let's see. Oh, this says, how do you sign up?
The Guardian MD website, you can access that. You can sign up online there. We are doing currently weekly meetings, small group meetings with patients that are interested, and you can sign up at those meetings. And the other way patients tend to become interested is when they're in the office for their routine visits. We have a poster and some flyers, and we give them some information if they're interested in it at that point. We've tried to make an effort to let the patients know what the program is. There's been some education involved in that, because a lot of people just don't understand what concierge medicine is. And then, we don't want to force it on them, but we'd like them to know that it's a good program, and there's benefits to them that I think they would appreciate, and we've had that experience so far with them.
And so, let me see. So if let's say I'm a physician and I'm considering this, I continue to have some of my traditional patients, and I can also have the concierge program, and then maybe things will start to shift after a time? Or?
You know, there's, you know, I interviewed several companies before we went with Guardian and looked at the different models that you could do concierge practice in. The models available are you can, you know, one model that's common is as of, say, you know, August 1st, you basically transition to concierge medicine, and your traditional patients, after some education prior to that, would have either chosen to do that, or at that point they would have to find another physician. You know, some models are hybrid models where you do both. You have traditional practice model and you do concierge part of the day or the week. Right now I'm in a hybrid model. I do both. I chose not to just, as of day X, cut off all of my patients I've had for 20 years. And I wanted the patient to decide. It may be that I end up seeing 80% concierge and 20% traditional, or 40-60, however it works out. But I didn't feel comfortable just making a line in the sand and saying I'm not seeing these patients anymore.
Right.
You know, we integrated it into practice in a way that they could transition to other providers we have available in the practice, and then recruited another male physician in about a year or two add to the practice, so if patients do not feel they need concierge at that moment, we'll have a place for them to go inside the practice.
Oh, so they can kind of move back, shift back and forth?
I would expect that some patients would do that. You know, the retention rate for concierge practice is very high, though. It's usually above 90%. Most people that get into it, they like it. You know, they stay there.
So we're going to hear from some people, hopefully, some patients who do really like it.
Okay.
So they'll be able to take that. Is there anything else that you thought I missed?
I think you did. Covered all that.
Anything
Those
else
two
that
things.
you wanted it? You sold me. I'm like, what? I wish I could range.
Where do I sign up?
Can you come to the Highlands too? How much does that cost to get you to come to my house?
Well, you know, I mean, it's a good combination with the, you know, concierge is a good thing. The anti-aging, regenerative, and functional medicine, you know, fellowship that I'm completing is exciting to me because it really does focus on bringing 21st century medicine to the forefront. You know, the focus there is with current medicine, you know, it takes a few years for what's determined to be the best thing to make it through medical school and residency and the trained physician to get out. And many, by the time that reaches the end user, the data may be several years old or not the latest thing you can use. So anti-aging, regenerative medicine and functional medicine sort of brings some of that latest technology to the forefront right away. You know, and it's exciting for me to add that as part of what I do.
Absolutely.
Yeah.
I think that's great. Okay, so I think, unless there's something else that you would like to include, I think we've got it all.
Okay.
Yeah, I think it's great.
That's good. I feel like I talk too much anyway.